And, well, here we are. We wanted to hear directly from nurses from the Mexican Institute for Social Security. And of course, nurses at ISSSTE, nurses at state institutions, at the Ministry of Health in every corner of our country. I- If you would like to participate, please, we welcome you here. Today, we didn't want this day to go by without recognizing you and without recognizing the importance of you on our health teams and the important, crucial role that you play. And it's not just about COVID, it's about other massive public health issues that you help with. And you make sure that we are all taken care of in the clinical areas. Thank you so much for. Let's open up the Q&A period. Blanco Valadez, I told you yesterday, then you, Natalia. We hadn't given you an opportunity, and then you. Yes, yes, yes. Good afternoon. Good afternoon. Congratulations, nurses. I'd like to ask you about the council agreements for health. Could you update me on how the stoplights are going to work in order to achieve the Susanna safe distance measures? Could you give us a couple of examples starting June 1st? As I understand, you're going to have this in place. And then we were also talking about availability for beds. I would like to know, how many beds do we need in the ICU? And what workforce, what personnel is necessary there as well? And lastly, the president talked about 10,000 ventilators that were acquired. When? I'd like to know. When? Where are they? How are they going to be placed? Where? So that we can answer and address this pandemic. Thank you, Blanca Valdez, for your questions. First, I'll go to the last question, and then I will ask you to repeat the other ones. This morning, we wanted to talk about the massive expansion that we have achieved in our national health system, specifically for users getting medical attention in every sector. This is so satisfying. This has enabled us to see and to be able to view the collegial, multi-institutional work that is going on, which had previously been a great limiter in our national health system because of a lack of investment, and also because of, over the last 15 to 30 years, the fragmentation that has gone. It's historic. It's always been a challenge. We've always suggested unifying and integrating all our institutes in the sector because we do have a unique health system here. This is something that we aspire to, and that's what we talked about at the beginning of this 6-year presidential period. We also announced that if we don't solvent the massive deficiencies that are structural and that lead to us having a reduced capacity at some institutions and higher capacity at other institutions all throughout Mexico. As everyone knows, in Mexico, our health system, besides being fragmented among institutions between the health ministry, IMSS, ISSSTE, PEMEX, and then the military hospitals, as well as the Ministry of Defense and the Navy, those represent 32 hospitals. And then we also have these other Mexican state health institutions. So we had the idea that perhaps we could integrate all of that, but then we saw that we were going to have to prioritize the foundations of integration before we would be able to build something foundations. Clearly, the COVID pandemic, beyond just the incredible challenges that it involves, well, we have that negative consequence on health and people's lives. Besides all of that, it's showing us how useful it is to work all of us together. So here we're taking a look at a health system that, well, in a temporary way, broke down those barriers to be able to attend to patients who were not insured at units that were private areas. And this is in
carga
Mexico City,
de
where we
enfermedad
have
con
the
el COVID.
highest burden of
Entonces,
disease for
esta
COVID.
mañana hicimos esta
So this morning,
presentación.
we made a
La
presentation.
información es muy completa
The
y muy vasta.
information is
Está ya
very
a
complete.
disposición o
It's
debería estar
available, and
en
it
este
should
momento
be
ya
right
en el
now
sitio
available for you on the website,
coronavirus.gov.mx con los específicos,
coronavirus.mx,
personal,
where you can
camas,
see
ventiladores
beds,
y otros
workforce
insumos que han
numbers,
sido
and
adquiridos.
supplies that we've
Y le pido si es tan
acquired.
amable
And
de
so if you could
revisarlo ahí.
please take a look at those numbers there.